A very good evening, Zimbabwe. Welcome to the Women's Roundtable on LiveTalk. I'm Marvelous Mhlanga-Nyahuye, broadcasting from my home in Washington, D.C. this Thursday, September the 2nd, 2021.
And I'm Sithandekile Mhlanga. Today, amongst other topics, we'll be looking at COVID-19, which is affecting many programs in the country and which is also affecting women and their programs, and including the schools, the opening of schools. And before we get there, we noticed that the Ministry of Health is saying, as of yesterday, 1 September, the country had 124,960 confirmed cases, including 113,527 recoveries and 4,438 deaths, with a total vaccinations of 2.6 million against the COVID-19.
And the government and the Ministry of Health also says that they need to vaccinate 10 million people for the country to have herd immunity. But they also say that as of yesterday in the country, we had 19 deaths yesterday and 187 people were confirmed COVID-19 positive. So we're going to be looking at some of these issues that are affecting the country at the moment, especially when it comes to COVID-19. But we also saw that during this week, worldwide, the United States, we saw President Joe Biden of the United States pulling out of Afghanistan, and that affected a lot of women, and some have been resettled in Africa. So we'll be giving you a report of the pulling away of the U.S. forces from Afghanistan as we go along in the show, and then come back to our guests who will be sharing with us what programs they are doing during this COVID-19 pandemic.
The Taliban celebrated on the streets of Kabul following the U.S. military's complete withdrawal from Afghanistan and the last American planes leaving. On Tuesday, the U.S. Commander-in-Chief announced the end of America's longest war.
I was not going to extend this forever war, and I was not extending a forever exit.
President Joe Biden repeated his reason to end the war that has spanned 20 years and 4 American presidents.
So we're left with a simple decision. Either follow through on the commitment made by the last administration and leave Afghanistan, or say we weren't leaving and commit another tens of thousands more troops going back to war. That was the choice, the real choice, between leaving or escalating.
Last week's suicide bomb attacks by ISIS-K, also known as the Khorasan Network, a self-proclaimed branch of the militant group active in Central and South Asia that took the lives of 13 American soldiers and more than 150 Afghans, triggered more criticism of the withdrawal. But some analysts say Biden is right to end the mission now.
In the longer run, I think the withdrawal will look more like the withdrawal from Vietnam. Short-term, a hit. In the longer term, cleared the way for resetting strategic priorities, refocusing American foreign policy, investing in the economy at home rather than the economy abroad.
The withdrawal was also marred by chaotic scenes as Afghans, fearful of Taliban rule, rushed to the airport hoping to be evacuated. Biden defended the operation.
No nation has ever done anything like it in all of history. Only the United States had the capacity and the will and ability to do it, and we did it today. The extraordinary success of this mission was due to the incredible skill, bravery, and selfless courage of the United States military and our diplomats and intelligence professionals.
The administration vowed to get about 200 self-identified Americans still in Afghanistan out of the country. Meanwhile, critics say potentially thousands of Afghans who assisted Americans during the war have been left behind and are now in fear of the Taliban's retribution.
There's been inconsistent policies as to who's the priority at the gate. 1 minute, the State Department is telling humanitarian organizations and individuals to bring busloads or groups of people in, or telling certain individuals to go there. And then the next minute, it's U.S. passport holders only or green card holders only.
Responding to VOA, White House Press Secretary Jen Psaki denied those allegations.
I have no confirmation of what you've just outlined. What I will tell you is that 117,000, approximately, many of them Afghans, people who are not American citizens, were evacuated. That's more people than ever in any airlift in U.S. history.
Following the end of the Afghan war, Biden vowed he would approach foreign policy through the prism of U.S. interests, including how best to continue to keep the American people safe. Patsy Widakuswara, VOA News at the White House.
We're hearing there a report by VOA of what's happening in Afghanistan, where we've seen a lot of women also fearing that some of their rights may be violated as the Taliban took over. Over to you, Star.
Yes, we had the Afghanistan issue, as Marvelous is saying, and one of our topics again is we are also looking at schools and how it's impacting on families, the schools opening, with some of the teachers not attending lessons, and some learners being sent away from school because of non-payment of fees, and all issues related to that. We'll be bringing our experts on education, including was a member Makoto Ngamashango, whose organization has conducted surveys on education and petitioned the ministry, and they have some success stories on the issue. Yabo ke kulabo abasanda ukusixhuma namhlanje ke sicubungula indaba ezitshiyeneyo. Okokuqala siyabe sikhangela ke yona i-COVID-19 okuyiyo ethinta zonke inhlelo ezenzakalayo, kungenzakala zingakahulumente, kungenzakala zingenhlanganiso ezizimeleyo, kungenzakala zingeze emakhaya emzini yabantu, wonke ke kuyathintwa i-COVID-19 yena edla ubhedu hatshi elizweni kodwa emhlabeni jikelele. Kungakho ke siyabe sixoxa ke lengcwethi zethu lapha ngokuphathelane lemisebenzi abayenzayo. Njengoba kulihlelo oluphathelane labesifazana, sizabe sikhangela ukuthi abesifazana kubaphatha njani lokhu, igcikwane leli lithinta njani inhlelo abaziqhubayo, njalo lithinta njani ukuvulwa kwezikolo zona ke ezisanda ukuvulwa kathesi. Sibona ukuthi kuloku khonona ngokuthi abanye abantwana babuyiselwe emuva lanxa uhulumende sithi kungenziwa lokho ngoba bengabhadalanga indleko zesikolo, kuthiwa ama-school fees, njalo laba abasema-boarding babiselwa kuthiwa balakudla okweneleyo kumbe ababhadalanga ama-fees. Kodwa-ke uhulumende uthi hayi kungaxotshwa abantwana bonke befunde. Sibona laba abalisi besithi labo bayakhalala umsebenzi nxa uhulumende engabengezeleli iholo, kukanti abanye bavele abahambi bathi ngoba benelisi abakutholayo kulutshwana, kwenelisi ukuyabafikisa ezikolo nxa bebhadala indleko zamabhasi bonke ukuthi baze bayefika, kukanti bathi bona ababo abantwana bazabafundisa ngani njengoba ke kungeneli lapha izinto eziningi. Yikho ke lokho esabe sixoxa ngakho lokunye. Marvelous.
Tinochingamidza vese vapinda pachirongwa chedu pari zvino. Nhasi pano paLiveTalk tichange tiri kukurukura pamusoro pezvizhinji zviri kuitika panguva ino yeCovid-19, tichitarisa zvakare mabasa ari kubatwa nemadzimai munyaya yekubatsira vamwe vakatarisana nedenda irori reCovid-19 pari zvino. Tichitarisa zvakare kuti pane zvizhinji zviri kuitika pasi rose. Takaona hurumende yeAmerica ichibuda munyika yeAfghanistan nemusi wechipiri iro svondo rino. Tiri kuona zvakare kuti vanhu vekuzvikoro, vana vekuzvikoro vakadzokera kuzvikoro, uyezve vabereki vazhinji vari kuchema-chema pamusoro penyaya yavari kuti iyo kuti pari zvino kuti vaendese vana kuchikoro, mari dziri kutaurwa muzvikoro dziri kuwanikwa idzo dzakanyanyokwira, uyezve ivo havana mari dzekuti vakwanise kunge vachibhadhara mari dzema-school fees. Saka tichange tichitarisa zvakare zvimwe zviri kutarisana nevanhu munyika, nyaya yekushandiswa kwezvinodhaka, uyezve nemabasa ari kubatwa nemamwe masangano ari kubatsirawo vaye vatingati ma-healthcare workers, kana kuti vamwe madzimai vari kuwanikwa vakazvitakura panguva ino yeCovid-19 vachizosangana nematambudziko akawanda panguva iyoyi. Saka tichange tiri kutarisa izvozvo, totarisa zvakare mamiriro akaita nyaya yedenda rechirwere cheCovid-19. Bazi rezveutano rinozivisa kuti kubva nezuro Zimbabwe yakawanikwa iyo iine vanhu vakashaya vanosvika 19, uyezve pane vanhu 187 vakabatwa nedenda iri reCovid-19. Asi kubva denda iri ratanga muna Machi gore rapfuura, pane vanhu 124,960 vakawanikwa ivo vachibatwa nedenda iri reCovid-19, uyezve 113,527 vakabatwa nedenda iri vakarikunda. Tozotarisa zvakare vakabatwa nedenda iri vakashaya vakamira vari pa4,438 deaths. Totarisa kuti nyika pari zvino yawanikwa iyo ichibaya vanhu nhomba vanosvika ivo 2.6 miliyoni nekudaudzira. Asi bazi rezveutano rinozivisa kuti riri kuda kuti riwanikwe iro richibaya vanhu nhomba vanokwanisa ivo kuti vasvike pa10 miliyoni kuitira kuti pawanikwe iya inonzi herd immunity. Asi regai timbowana munyarikani wedu wekutanga vari pano pachirongwa timbonzwa kwavari kuti vapinde muchirongwa. Muzvare Chipo Mulambo timbonzwa kuti zvii zvavari kuita pasi pechirongwa chavari kuedza kubatsira madzimai panguva ino yeCovid-19. Regai tiende kwavari tinzwe. Alo muzvare Mulambo, mungatiudzawo nezvesangano renyu here uyezve zvamuri kuita kubatsira madzimai?
Makadi henyu. Ndinonzi Chipo Mulambo, ndiri kutaurawo nemi ndiri kuHarare. Tine organization yedu inonzi Rona Flow Foundation. Tingangoti mandate yedu kupromota madzimai nekuvabetsera kuti vaende kuzvipatara vanosununguka zvakanaka. Tiri kuwana kuti vakadzi vakawanda vari kuzofa, vari kufira kudzimba, havasi kuenda kuchipatara, vamwe vanosunungukira pa. Saka takabatanawo tikati tingabetsera vakadzi sei panguva ino yeCovid kuti vaende kunosunungukira kuchipatara tidzivirire njodzi.
Mumbotitaurawo nemuchirungu kuti what's your organization doing to assist women during this COVID-19?
Can you say that again?
In English, please.
Oh, can you repeat the question?
What's your organization doing to assist women?
Okay, so the mandate of the organization is to enhance and promote maternal health in Zimbabwe. As you know, Zimbabwe is one of the highest maternal mortalities in the world. So what we did is we came up with a hamper, which we call the Apona hamper. Basically, it's an incentive. We put together a hamper that entices women to go and deliver at the clinic. We work with about 29 village health workers. We piloted the program in Chiweshe. So we work with 29 village health workers there, but our programs are not only restricted to Chiweshe, we are also in Harare. And sometimes if we get a request, we do send out our hampers. So what we do is we put together this hamper. It's got a bucket, it's got cotton wool, it has some baby clothes, it has a bar of soap, a bottle of spirits, and we also put whatever else that we get from donations. The reason why we put this hamper together is because before we even started doing programming work, Tainzwa, Kuti, we used to find out that most women, particularly those in the rural areas, will not go to the clinic because perhaps they don't have the cotton wool that they need after delivery, or they don't have a bucket which they are required to bring so they can have water when they deliver. So we found it really sad that a woman can lose her life by ending up having a baby at home unattended, and most of the time we find women end up dying, or their babies die, or they have birth injuries and there are no nurses. So I can pretty much say our whole thrust is to figure out incentives and to entice women to go and deliver at a hospital or a clinic.
Thank you so much. We were hearing there from Chipo Mulambo, who has an organization based in Zimbabwe. She actually relocated back from Canada in November last year to go back to Zimbabwe and start this project. But before we go to start, just hear what BOSA are doing in terms of the education system in the country, let's just take a listen to an interview that I had with the Vice President of the MDC Alliance, Amai Lynette Karenye Kore, where she was talking about some of the work that they are doing in order to help women during COVID-19. And she also spoke about what she thought about having a female president, vice president in Zambia. We saw that Zambia now has a new president, but Mai Karenye Kore was talking about the vice presidency in Zambia, which is now being headed by a woman. Let's take a listen. Chirongwa ichi munochipakurirwa neni Marvelous Msanganya huye ndiri muWashington uko ndiri kutefenyura ndiri kumba pamusoro pedenda rechirwere cheCovid-19. Nhasi pachirongwa chedu taisa rombo rakanaka tine hurukuro nemumwe wevatevedzeri vemutungamiri webato reMDC Alliance vaNelson Chamisa, amai Lynette Karenye Kore. Regai tiende kwavari tinzwe kuti vakadii kwavari ikoko uyezve kuti vanoona sei zvatakaona zvichiitika muZambia umo tiri kuona pari zvino mave nemutevedzeri wemutungamiri wemudzimai. Tinokuchingamidzai nemufaro pano pachirongwa chedu, amai Kore.
Magadi zvenyu risei zvako Marvelous.
Aiwa, tiri wadi. Tachiuda kunzwawo pfungwa dzenyu nemamiriro akaita munyika yeZambia umo takaona mudzimai achipiwa iye kana kuti achivhoterwa kuti apinde pachinzvimbo chemutevedzeri wemutungamiri mutsva weZambia.
Tine mufaro zvikuru semadzimai. Kufunga kwangu ndofunga pasi rose rakagamuchira chiitiko chakaitika kuZambia. Chinova chakarakidza kuti president wemuZambia anoremekedza kodzero dzemadzimai, anoremekedzawo chinhu chinonzi mudzimai. Akarakidza kumapresidenti mazhinji kuti haiwa haungaiti baba pamusha uchinge usina amai. Saka akaona zvakanaka kuti akaona akatora munhukadzi akaiswa pachigaro chevice president anobatsiridzawo kuti nyika inge ine utongo hwakanaka. Zvikuru isu semadzimai chatakanyanya kukosherwa nacho ndechekuti aiwaka munyika zhinji hamukoshesi madzimai, asi wezi rasimuka richibva paZambia rinova wezi rinorakidza kuti aiwazvo vana Malawi vakazviita makore aya. MuZimbabwe zvikatombovapo, ZANU-PF ikabvisa munhukadzi ikaisa munhurume, asi MDC Alliance inotungamirwa naPresident Chamisa yakaona zvakanaka ikapinza mubumbiro rayo payakaenda kuCongress kuti ayo deputy umwe chete anofanira kuita mudzimai. Zvinova ndiwo tsoka dzateerwa nedzimwe nyika kuti aiwa vanhukadzi vanewo chekutaura maringe nezvematongerwo enyika. Saka tinozvifarira uye takanzwa kukosheswa kuti aiwa semadzimai tinokosheswawo.
Tombotarisa kuti Zimbabwe ichange yakatarisana nesarudzo muna 2023. Pane zvamungati makadzidza here kubva kuZambia panyaya pekukosha kwevhoti yemudzimai uyezve nevechidiki?
Ndakaona zvakawanda zvandakadzidza kuZambia. Chekutanga chandakadzidza kuZambia ndechekuti vana vatakabereka ndiwo vanewo chikamu chakawanda zvikuru sei pasarudzo. Saka ndakadzidza kuti aiwa savana mai tisu tinobereka vana vasina mabasa, tisu tinova varume mudzimba vasina mabasa, tisu tine hama neshamwari zviri kutambudzika muZimbabwe. Saka zvatinofanira kudzidza ndezvekuti aiwa saana mai ngatikurudzirei vana vedu, varume vedu nehama dzedu kunorejista kuvhota. So ndakaona zvakakosha paZambia kuti vana mai vakamira neuwandu vakati aiwa vana makore ese semadzimai tisu tinopinda mutsetse tichinovhota, vana muchisara kumba. Asi rwendo runo imi sevana marwadziwa kupfuura isu vabereki, chiendai mumutsetse. Ndakakosherwa ndichiona vana vemuZambia vachienda vakapfeka magauni kuratidza kuti aiwa vana mai vedu nana baba vakatidzidzisa asi hatina mabasa. Saka kuti tiwane mabasa handei tinorejista kuvhota. Chimwe chechipiri ndakakosherwa kuti semadzimai vakakurudzira runyararo ndakaona pisi yakaitwa muZambia inova yakarakidza kuti aiwa kana vanhu vakabatana vakavhota neuwandu aiwa chekuita hapana chekuti zvinobirwa hadzibirwi sarudzo kana vanhu vakasimuka neuwandu. Vanhu zvese ndakadzidza ndechekuti semadzimai ndakadzidza kuti aiwa kana isu tapedza kuvhota ngatibikirei vana vedu vari kunoenda kunogarira mavhoti, isu tapedza todzokera kuti tinobatsira vana vedu mapolling agents kuti vanzwe kushinga, nekuti kana tauya neuwandu kubira hakubiriki nekuti vhoti rinenge rasimba rakakurisa zvakanyanya. Saka ndakadzidza zvikuru kuti aiwa savana mai tisu mateam builders, tisu national builders. Saka tikaita izvozvo zvechokwadi Zimbabwe inoshanduka 2023 tikava neutungamiri hwavachamisa hunoita kuti vana vedu vawane mabasa, varume vedu vawane mabasa, isu todya tichiguta, zvikoro zvedu zvova nedzidzo yakanaka, zvipatara zvoita mishonga, macivil servants edu owane kuhora kwakanaka.
Tombotarisa kuti pari zvino Zimbabwe nepasi rose tiri pasi peshamhu yedenda reCovid-19. Pane dzidziso yamuri kupawo here kumadzimai nyanya panyaya yekukosha kwakaita kutora nhomba nezvimwewo zvakadaro panyaya ino yeCovid-19?
Aiwa, tiri kukurudzira seMDC Alliance inotungamirwa navachamisa. Mukatarisa sekretari wedu wehealth Dr. Madzorera vanogara vachiburisa zvekutaura kuti aiwa handei tinobayiwa nhomba. Isu semadzimai pese patiri kusangana mumasocial media tiri kutaura kuti aiwa handei tinobayiwa nhomba tizvidzivirire. Kana chikakubata wakabayiwa, tine matestimonies evanhu vari kubatwa naichochi chirwere asi vachizorarama zvakanaka nekuti vanenge vazvidzivirira. Tiri kukurudzirawo zvevanhu kuti aiwa ngative neutano muzimba. Patiri kupinda mumastriti imomo ngatitarise kuti taita utsanana, tasanitizer, tageza maoko. Kunewo vasina mamaski, sebato reMDC Alliance tiri kubatsiridza kuti tipanane zvishoma zvatinowana izvozvo kuti munhu wese ange aine kudzivirirwa, nekuti chirwere cheCovid chauya zvakanyanya. Kumaruva kwatiri kubva uku tinadzo hama dziri kuparara nedenda irori. Saka seMDC Alliance tinozvikurudzira zvikuru uye tichibatsiridzana kuti aiwa chinhu ichi ndechemunhu wese, nesu ngatibatane tirwise denda irori uye tonamata kuti Mwari atizwire nyasha Zimbabwe ione kupona.
Ko panyaya yekuvhurwa kwezvikoro tiri kuona vamwe vari kushushikana vachiti zvanyanya kurumbidza kutaurwa. Aiwa, apo tanga tiine hurukuro naamai Linet Karenye Kore vebato reMDC Alliance vachitaura ivo pamusoro pezvirongwa zvavari kuita mukuedza kuti madzimai nyanya vekumaruwa vaende kunobayiwa nhomba dzeCovid-19 uyezve kuti vawanikwe ivo vachizvidzivirira kubva kudenda iri reCovid-19. Asa
abanye ke abahlonitshwa bethu bekhuluma ngokutshiyeneyo okuphathelane le-COVID-19 lokuvulwa kwezikolo. Joining us now is Magodonga Mahlangu of Women of Zimbabwe Arise, whose organization has done a lot in education and in fact, let her tell us all about it. I welcome you to the show, Mahlangu.
Thank you for having me.
Yes, if you can introduce yourself and what your organization thinks about this, the schools opening and what's going on now in schools.
I'm Magodonga Mahlangu from Women of Zimbabwe Arise, like you already said. I'm the project lead for the right to education, which is called Imfundo Yipa-led Education Without Heritage. We've done a lot of community awareness in terms of learning under the new normal, and then also of the current Education Act and also the prevailing policy education, so that education policies, so that right holders, by right holders I mean the children and the parents, understand what is due to them and what is the obligation to educate their children. But surprisingly, there's conflicting statements from the minister or the government, if I may say, because on the other hand, we have got the Education Policy Act, Amendment Act 2020, it speaks to free education. But then we had the president appealing to parents to assist. At the same time, when we were on the ground, we realized that parents are really struggling, and even to send their children to school with food on their tummies is going to be a mammoth task to fulfill. And so to ask parents to start providing PPEs like sanitizers and other stuff to the school and paying fees for that matter and levies, it's really insensitive by the responsible authorities such as the government.
Yes, and so far, have you seen what's going on in schools? Do you think those PPEs are enough? Children masked, and is there any education taking place? Have you seen what's going on now?
What is currently happening right now is since the schools open for the examination classes, we've seen children loitering. There are no teachers in some cases. In some cases, the classes are not here. Teachers are still asking parents to provide giving material, and in some cases they are saying parents should come and clean because, especially at primary level, they are saying they don't think the learners at their age can manage to clean, and they are asking parents to pay. And as per the circular letter of number 9 of 2021, that speaks about the opening schools and the pro rata payment system. In some cases, we've noticed that schools are abusing, but they're asking parents to pay for 80 days. And then those are national classes, and yet they have not started teaching because some teachers are not at school. And then the other non-examination classes, we are noticing that they are calculating at 25 days, yet we know that the circular clearly says that in some grades, some classes will have to attend maybe once or twice a week. So we are not getting that 75 days. Instead of them calculating reducing, they are calculating in their favor. And then in that case, they are taking parents to pay more for a service that is not rendered. And with the rural teachers, they are more affected because we have noticed that some of teachers, even though they try to go to the local rural bus terminals to go home, to go to their schools, they came back because there were no buses. We realized that is the issue of the rural buses being used as the urban transporters now they are conducted under ZUCO. So these are the challenges that teachers are facing. Already teachers are complaining about their living wage salaries, and then they have to go and try to find transport and come back. That is the waste of resources, and they are ill-equipped even to go to school. The other worrying thing is that you are already talking about the national examination taking place. We are oblivious to the fact that these learners last year they were non-examination classes, so they were not prioritized in terms of teaching. And this year they were only taught for the first term. So what are they going to write? So these are the things that are really worrying us, and the education system in Zimbabwe will really need to put our efforts together and our resources together to make sure that we educate our children. Otherwise, this is going to be a lost generation in terms of education.
Yes, while you are still on English, marvelous. You are on mute.
Give us an update on how your organization is working with some of these people that are facing these issues.
Yes, I think you were muted. Maybe she didn't get part of your other question.
Maybe you can repeat to her because the audio is on your side.
Okay, say your question. I couldn't get it either.
I was saying that how is the organization working to assist those affected?
Yes, Makodama, if you can.
Yes, our organization, yes, we are, like I said, we have been raising awareness to communities about the policy, and then we are also encouraging parents that the Constitution covers the right to education. It gives education as a right, and the Education Amendment Act 2020, we need parents to refuse to pay or to refuse to allow their children to be chased away from school for non-payment, because the Education Act is quite clear on that, and the ministry is clear that children should not be chased away from school. And the parents should negotiate a plan to pay school fees. But even though school, but it also is go to best school to mitigate and also the school heads are aware that what they are doing is illegal. But it also comes with a risk because of the COVID-19. You cannot be allowing people to be going in and out of school when they are not supposed to be in school. So these are the challenges to are facing, and we are still lobbying the government to say, please look at the issue of paying. Rather, right now at this time, especially in this context in time, let us go back to the child per capita grant. And the child per capita grant was used to work, and it was last paid, I think, when Mr. David Colcott was the Minister of Education then. It used to help a lot of schools where they could not raise the revenue through levies or fees. Their parents could not pay because they would get money. When we were talking about child per capita grant, the schools are able to get a lump sum of money, and when you get a lump of money, you are able to buy essential materials for learning and teaching materials in bulk. But right now, they cannot do that because parents pay maybe. They're not paying in numbers, and some parents are not paying. They can't afford to pay. Not that parents don't want to pay. So we are still looking for the capital grant to pay while we are progressing going towards free compulsory primary, free compulsory education for PCB to
Thank you very much. Over to you, Star.
Yes, and you also mentioned that there was this grant which used to work when there was Minister David Coltart of the MDC, but we realized that the government also says it is BEAM. Is this BEAM assisting many children?
Unfortunately, BEAM is the most abused fund, and the way time again try to inform the ministry responsible, and even unfortunately, the other thing about the BEAM, the basic education assistance module, is not housed within the Ministry of Education, housed under the public service. So that money for it to filter to the Ministry of Education takes time for allocations, approvals, and there is also a challenge of corruption within communities because we have conflicts where people are being the school is supposed to choose the committee that is going to say going to communities and beneficiaries. That's where the corruption is. And I think in 2014 and in 2016, the Auditor General, Public General is already came out with a report blatantly condemning the abuse of the BEAM. And when it's other thing about BEAM, when it is allocated, it is delayed in payment. With schools that when they have not received for the past 2 years. So BEAM is not working. Let us go back to the child per capita grant. Why we are trying to progress this? We realize the right education.
Yes, you said one of the strategies is that the parents should not pay fees because there are provisions within the Constitution that allow for free education. How practical is this? Do you find a unity of purpose here, or some will go ahead and pay and some pay, such that those who don't pay find that their children are no longer learning?
We advise parents that those who are in the best interest of everyone for our children to learn, even parents who are those who can afford pay. But then one challenge that we're seeing that those who pay now want to sideline or discriminate against those who have not paid. It is illegal. So we're going to the school and support whatever the parents are giving. Don't ask learners about this. This is an issue between parents and the school. Allow children to go and learn. But if parents find out that their children are being discriminated, then we have taken a lot of cases on that, and we've approached schools. We have a good relationship. We're working on this project. We're working in Macedonia, and we've good working relationship with the PEDs, that is the provincial education directors, the district schools. We are all on the same page on this. But teachers should refrain from chasing learners, and teachers should not be talking about fees and levies. They should focus on teaching. They should be complaining about saying we don't have this material, but rather than interrogating learners as to how lecturers and other staff, the non-teaching staff.
Yebo ke siyabonga sesingakhuluma ke sesizabuyela ke ukuthi sikhulume ngolimi lwesiNdebele ngakho konke kade sikuxoxa lapho ukuthi siyabona izikolo zivuliwe njengenhlanganiso ke elwela ikhankasela kakhulu ezemfundo ukuthi ziqhubeke kuhle inhlelo lithini ngalokhu bese kwekulungele yini ukuthi zivulwe izikolo.
Izikolo khona bekulungele ukuthi zivulwe kodwa indlela okwenziwe ngayo ayingalunganga ngoba singananzelela ukuthi kube lokuxokozela ngoba le nqushinqushu yokuthi khona ku-announce WhatsApp khona kule i-lockdown iyaqhubekela phambili nge-14 for another 2 weeks. So after 2 days basasokuvulwa khona abazali abaningi vele besikhangele ukuthi khona imali yakhe kumele ibe ngefizi imali yakhe kumele ibe yamafutha ukudla besikhanka usebenzele i-grocery aid iza-expire ngikela ngithi sesiyivule sesiyidlile basasokuvula so komnyana kuyahlukumeza so kade kumele kube lokuhlela okukhulu khangela kakhulukazi ukuthi umongameli welizwe wazoba ucele abazali ukuthi khona bancedise ngento zokuthi londoloze ukuvikeleka ngesikhathi se-COVID. Ubacela njani abazali umbuzo abazali ababuza usicela njani thina singela mali kanye nohulumende ukuthi akela mali umzali uthola ngaphi imali bese sinanzela futhi ukuthi ababalisi lawo bayakhalaza bekhalaza ngesikhona ukuthi nawe ukwazi ukaphethe kodwa ezikolweni bayakwazi akulungiselwanga lutho leholo labo nje ukuthi baziphilise bona alimele bese sinanzela ukuthi utitha yena phela ungumzali nxa kuthiwa khona abazali babancedise kuma-PPE usuke zotitha la lapho umntwana afunda khona kumele ucontribute ngayo imali nesiholo phela sesikhangelisela kulabanye abazali vele abangasebenzisi abanye ngama-informal traders batitha ngaphiyo mali yokulukwa wonke umuntu athi kuyathengisa uthengela abantu uthengisela abantu so ngezindlela ezihluphayo sesikhanzela kakhulukazi ukuthi kule zikolo zamakhaya izikolo zamakhaya singananzela kakhulukazi ababalisi abaningi abasemadolobheni babone bephenduka vele ema-rankini lapho bathi lapha amabhasi emakhaya bethi bathwele ukuhambisa ngoba amabhasi nalawa azivumelwayo bathola emakhaya abo atholakala besebenza andazukho yiwasathola abantu emadolobheni abo Bulawayo so yikho ukukhangela ukuthi khona imali ivele yona kayenele ukuthi uhambe esikolo nakho uhambe kuyaphenduka neziningi lelo so imali ziyahlala siyakhona so isikhangela khona ukuthi khona uhulumende yena vele nxa esikhangela ukuthi khona kule mthetho yokuthi khona imfundo kumele ibe ngiyamahala education economic policy 2020 eba 6 March 2020 leyo iyetsho kakhulu ukuthi abantwana abangabaxotshwa babangahlukuluzwa nxa ungasabhalisi kodwa khonokho izikolo azikulandeli esikhathi ukungani zingakulandeli ngoba uyathola utitha ehlezi eklasini kulesi isikolo uyezimasawafundeni bakhona ukuyalingene ekhangela isitorum ikhangela isitorum zabotithala akula ngitsho utitha ehlezi eklasini wathengisa ama-request amatitha akade ecela amanina WhatsApp ethi bangilapho nokuthi bathenge so utitha ehlezi eklasini kule test eli-1 kumele abhale egebhodini ukuthi khona abantwana babana itshokukayo so nxa yaphetha kufuna njengenhlanganiso ukuthi khona akukhankaseleli ukuthi khona lokho uhulumende ukuthi khona awubuyele ku-tax capital grant yayivele ikhona phansi uthina kwayokubhadala athina ibhadaleyo ngumnumzana u-10 i-tax capital grant inceda kanje ngoba yabala inani labantwana besikolo imali uhulumende uyobhadalayo engathi umntwana oyi-1 ne-10 dollars bayiqoqa ndalana imali ihambe ilamsana injalo ngobuningi bayo ngaleyo ndlela izikolo ziyenelisa ukuthi khona ziyethenga lazo okuqakathekile abangakusebenzisa large quantity so yinto indlela esingathi yabela kuyo bese sinanzela ukuthi abantu abakhona uhulumende uhlale kwaba ne-BEAM basic education assistant module ayisebenzi leyo ngoba ngeyinye indlela yokuncedisa abizwa ngabantu bakhulukazi ama-community ngoba kuyakhetha izikolo ukhona abazali abazangena community yokuhluza esigabeni ukuthi ngoba nabantwana abaninzi abangathola ukudla uthole ukuthi ilist ingabande sokungena i-corruption sokudrayivana abantwana abayibo abaswelayo kakhulu begcine bangatholanga esikhathini sokuthi kule mbuli sekumele ngama-targeted water uza ibhizinisi iyabhadelela 2 khona kula bantwana abangu-3 So i-1 year ngathi ikuyabhadala abantu ishiya abanye abantwana ngaphansi. So kayisebenzi because ikhankasi lakho i-tax grant. Why sisalungiselela ukuthi khona imfundo yezine engamahhala from njengalokho kuthiwa umthetho wezemfundo wenzakala. Asibuyeleni ukuthi tax grant ikakhulukazi ngekhathi COVID le ngoba singayithola leyo mali bathola izikole zinenelisiplan abakhobezi sebenzile bontuezenzakalayo. Wesikhangela ukuhlanza laba abantwana ababhala ama-examination basiyezawunanzela ukuthi bebengaqakathekiswanga kakhulu lapho bebengofom 3 bebengofom 6 bebengofom 5 wafundiswa laba ade babhala ababhalileyo labo basenye lo nyaka bafunde 1 term kuphela bathe befundele 1 term wahlala phansi sokuvulwa wasebenzile embhalweni bale 80 days usukaso 80 days ngezingaba 40 days kwawo 45 kwazenzela ama-last days la kusathazela ukuthi khona abafundanga ukuya ngayo futhi kusenzeni labo bazafeyila befeyila baresistile imali zangkhona izindleko zangkhona zingalandela uhulumende last year wafoza waza nokusabhale babhala bengafundanga lo nyaka uthe khona kusaphimenta ama-examination fees wathi laba abangayikho kufollow formalisa abangalokhu abasabhekayo so kuba umlando wabazali umntwana lo uhlala ngaphansi phansi nephansi.
Yebo-ke laphana sixoxa ngesingisi uke wathi kulolunye njalo uhlelo eliluqhubayo labanye iziphathamandla zemfundo kwezinye izigaba zemathebelele nje. Yiluphi uhlelo njalo kuyini elikwenzayo ukuthi likhulumisane nohulumende ukwenzela ukuthi kube nomahluko kwezemfundo?
Umkhankaso esilawo ungaphakathi kwesihloko sokuthi imfundo yilifa le education is our heritage. Lo mkhankaso sikhangela sisebenza lawo usuku lwethu emathebelele sivulawa emathebelele nasematebelele sawo. Sibelela iziphathamandla kakhulu abo-PED o-Provincial Education Director lamo-DSI abakhangele ngezikhethi ukuthi khona umthetho siyawubona ukuthi kodwa singakunanzelela okwenzakalayo ukuthi on the ground ayikho. Iziphi inkinga ehlangana lazo yikho kwenza isithulaselelana ukuthi oyigmasa basile o-PED basile hayi thina ifethile iyabuya yisithi kodwa i-funding yangona uthole okungazi khona ngale ngaphansi on the ground. So nxa singabe siyakuhlangana le-Ministry of Education le-Parliament Education Portfolio eziphathelana zikahulumende sifakele ukuthi hayi inkinga yethu ilapha ile mthetho othi khona akubekwe nje kubekwe kodwa i-practice ayiresolve yikho odala ingxabano phakathi kwabatitsha labazali ngoba thina kwenziseredini ezigabeni atshela abazali ukuthi amalungelo lawa uproject nalezi sirebele kuduna kakhulu emakhaya labasobhuku ukuthi bakhangele ukuthi ezigabeni zabakhona akuwamukela bakuphatha konke ngalokho kodwa banazele ukuthi na akukho uhulumende lapha aphathisa so kade kuhle ngoba sikwazi ukuthi utitsha yena vele ukhitshwa yini uyegimasa yena ukhitshwa yini uhulumende ufilela ngaphi utshela ama-right holders ukuthi lelungelo zezibanda kodwa ngapha engasafaki imali eyeneleyo so uhlelo esisebenza ngalo kakhulu kakhulu nxa sikhuluma ngokwenzakalayo amathisha zankonala labanikazi bamalungelo oluntu abanye ama-right holders sekubona so esibisana ngakho kakhulu kakhulu ikhathi esingesikhathi lama-policy esithona inclusive learning inclusive learning kumele igoqele ilapho bonke.
Yebo, kodwa libona ingani uyaphumelela yini umkhankaso wenu lo ukuthi imfundo yilifa lethu, education is our heritage, kumbe kuzaba yingxoxo kuphela? Libona ingani akhona amanyathelo uhulumende azawathatha njalo uzalandela izixwayiso zenu?
Okukhona ukuthi okuhle esingathi kukhona kade ukuthola ukuthi lo mthetho i-policy nje qala ngathi siya ungakabe constitution ungakabe le-policy kanti i-policy ikhona ongakuthi sokulula-ke ukuthi abazali nxa bengazimisela ungahamba khosisa yayiwina leyo nto ngoba vele umthetho ukhona and uhulumende kusakhulapho iministry yohulumende bazayo ukuthi nxa esithayi khona ukuthi khona umthetho uthi bakhuluma ukuthi progressive kusathi kuphakilina ayihlekho i-progressive ayihleli ilahlile ngoba selitrogressa kathi abantwana imfundo yakulesi imfundo yakulesi sigaba kati ilokhu isiwa isiya phambili themba ubani lobanezi bakuyazibonela vele kanti ngasekithi wonke ukuthi khona konke ukuthi ezemfundo zinjani ezemfundo iyawa azikazisiwa Now last year, national examinations under the basis of privatized learning. Abantwana ababhaleleyo bengafundiswanga abafundile bazifundiswa abazali abafanelekile ukuthi bathenga amadatha babe online abahayela ama-private tutors. That is privatization of the right to education. The way commercialization ole mali ngizakuthola lo. So uhulumende lapho bona nxa abazali bengazimisela uhambe constitutional court live khetha abayiwina. And abasinanzila futhi Zimbabwe ngo-2015 yayenza lokho abathi which is a peer review of the government. If you are saying abantu ama-recommendations athiwa ngo-2015 about almost third of the recommendation that umsebenzi wemfundo kwe-education, all these things. Lo nyaka kumele ba-review sesikhathi ukuthi sibhale lelo bhalo futhi ukuthi baphambanise lapha nalapha. Khuluma khona nxa sikhuluma njalo sikhuluma ngamalungelo ezoluntu eZimbabwe. Kwenza kakhulu zeZimbabwe Human Rights Commission. iZimbabwe Human Rights Commission ile ingwalo zesiphumileyo eziningi. Kesaba locwaningo lokuthi khona abantwana vele under lockdown baphila njani. Lockdown through the eyes of learners. Ilikhangela ukuthi abantwana bavuka besenzayo, batshona besenzayo ezimpilo zingabi. Igwalo lolo selinike khona iZimbabwe Human Rights Commission ukuthi khangela nini ukuthi ezemfundo zininjani. Khangela nini ukuthi vele baphila njani abantwana. Ugwalo lolu balisebenzisile kakhulukazi belungiselela ukuthi labo bayeripota khona ngale nxa sokulithula iZimbabwe ngoba sinamandla. Kuyahlela kakhulukazi ukuthi iZimbabwe Human Rights Commission nxa khangele i-infrastructure review bale local abathi status ongangokuthi khona balelungile ukuthi balethuba balelungile ukuthi ba-report direct. Ungathi ama-civic organizations xa sisiya ku-infrastructure review sihamba siya lama-shadow report. So khona kufuneka kakhulu ukuthi khona sisebenzela lo mama wezamalungelo eZimbabwe ukuthi iwathakazela ama-report ethu nawasebenzisa.
Hayi siyabonga. Over to you, Marvelous.
We were hearing there from Ms. Magodonga Mahlangu, who was talking about some of the projects that they are doing in order to sensitize people about their rights according to paying school fees. At a time where we've seen a lot of schools have been open during this COVID-19 pandemic, but we have our other guests coming in who's also going to be talking about what they are seeing on the ground regarding the opening of schools and the situation that some of the kids are facing at the moment. Hello, caller.
Hello.
Yes.
Hello, Atereri Matabi.
Aiwise wadi tiri kuno tiri wadi jedu tipeiwo stare nyune stare organization yenyu mobva matiudzowo muri kuita panguva ino yekuvhurwa kwezvikoro uyezve takatarisana nezvatiri kuona zviri kusangana nevana pari zvino.
Zita rangu ndaitwa Christina Madamombe Murombo. Organization yedu inonzi izvo nemubatira pamwe trust. Tiri mukati mekushanda nevana pari zvino tine program yekuti vana varegedze kuita zvinodhakwa uye tiri kubatsirana nevabereki vane vana vanga vatoita zvinodhakwa vanga vazhinji vacho vavetove pakukanganisika pfungwa vanenge vava kutorwara nepamusaka pekutora zvinodhaka zvikuru sei crystal meth yavanotiyo mutoriro guka kana kuti dombo. Tiri kutarisana nevanhu vari pamazera anotangira iwo kubvira kuprimary chaiko education ma13 years vakawanda ma16 18 kusvika kuhigher institute of learning kumauniversities vari kusvika kuma24 25 26 years nechimwe chikamu chevanhu vanosvika kuma30 years asi vana vakabatwa zvikuru neguka iroro ndivavo vari pakati pezvidzidzo zvikuru sei zvekumauniversities. Takatarisana nevabereki vari kutibata vachitaura matambudziko avasangana nawo ekuti vana vari kutadza kuenda kuchikoro. Vana vatadza kuenda kuchikoro nekuti chirwere chinoudzwa nekutora zvinodhaka zvakaita sana mutoriro chinokanganisa pfungwa. Chinoudza kumwe kutambudzika pamuviri wemwana nepfungwa dzake kunomuchinjisa unhu hwake. Zvichireva kuti zvinhu zvakafanana nekuenda kuchikoro zvinenge zvava zvimwe zvinhu zvaasingakwanise kuita. Saka vana vazhinji pakunovhurwa pari kuita zvikoro izvi vachatadza kudzokera vari kudzoka havasakwanisa kuenda. Vamwe vazhinji vatanga tichifonerwa vana vari kufanira kunonyora ma-examinations avo, vamwe ma-examinations efinal chaiwo, asi vana avo vari kutadza kuenda. Ende chanyanya kushata ndechekuti vana ava vanga vari vana vanga vari kuendeswa pamwe zvichida kuzvipatara, ende vanga vari kucherechedzwa vari mukati memhuri vachichengetedzwa, asi pari zvino tatarisana nevana vakuzodzi vachinomira vega, ivo pfungwa dzavo dzisisina kumira zvakanaka. Tiri kuona vabereki vari kuda kuvavarira kuti vana vaende, asi hazvisi kuzonobuda. Ndo vana vekumayunivhesitizi vanonyanya kubatana nekuita mutoriro guka odombo, pachirungu iri kunzi crystal meth, vana vekumayunivhesitizi nemasekondary schools.
Maybe if you can just tell us in English, you said that you're realizing that some children are not able to go back to school at the moment because some of them have gone into drug use or are abusing drugs, especially during this COVID-19 pandemic. Tell us a little bit about that as schools open this week.
Yes, as schools are opening this season, second term, I think, or third term, I'm not quite sure right now. We are faced with a lot of students, especially in the age groups of between I would say 18 to 26, 27. And again, a percentage, a small percentage will primary, 13, 14, 15, 16. But we are saying the bigger percentage is in higher education, universities. That is where we are more affected. We are having students who are dropping out because they can no longer concentrate on education. Because what crystal meth does is it destroys someone's brain cells. So it means the person that is doing crystal meth can no longer concentrate on education because of mental health issues. So they are no longer going to go back to school. Parents may try to take them, but it's not going to happen.
Maybe if you can give us details of how people can get in touch with your organization, because we're running out of time, so that they can be able to understand how they would know if their children were affected by some of these drugs that you talk about and are not able to return to school.
Yes. Parents may see if their children are affected by just noting personality disorders, psychotic disorders, and things like depressions, aggression. Those things may indicate drug abuse. We may be contacted at 0772379751. That is my number.
And your organization's name again?
Mubatira Public Trust.
If you can stay on the line, because time is not on our side, I would like to give our other guests a time to just come in and weigh in, because we have a few minutes left. So please stay on the line.
I will. Thank you.
Yes, coming back to you, Magodo Ngamahlang, we heard what our other guests said. Would you say that the issue of drugs is a big problem, especially in schools in Bulawayo and Matabeleland?
Yes, it is a huge problem. It was one of the issues that we found out when we were doing the survey, the questionnaire on the lockdown through the eyes of learners. And we realized that some of these children were claiming that they were being enforced by adults to it, and some were being sent by adults to buy the drug for them, and some they were going to go to illegal goods, and they got and some they got addicted to the drugs while in Bulawayo, while in water or water points or bush water things. It was really worrying. It really shocked us to the core to realize that drug is a problem, and even the sexual activeness of the young kids, as young as the 9-year-old were speaking about that. All these things we were really worried.
Yes, and are we talking of expensive drugs here, or just the ones they can access? What types of drugs did you find out were a problem? in your survey?
They were talking about the Nyaope, they were talking about something like from the cough mixture. I forgot the name. The cough mixture was the common, and then we were talking about Zimbabwe and other stuff that they come across. They will just use it. And most of the kids were saying they used it due to boredom, and some will use guess that they were exposed to too much violence at water points and at home, domestic violence, and then escape from that, they will just use it.
Yes, that's
saying that they are suppliers. So some of them saying that they are suppliers like Ntumbani and Pokoma. They say they are non-drug dealers that supply this drug.
Yes, that's an important observation, Marvelous. I don't know how much time we have. If you could say that in a minute, ngesindebe.
She can, yeah, we've still got 5 minutes. So
yes. Yes.
Let me get the lady from Zimbabwe to just round off in 30 seconds. Then we'll let Amai Mahlangu come in so that she can round us off because she has the bigger picture of the education and the survey. Amai Murombo motipa mazwenye kupedzisira nekuti chirongwa chedu chaakupera kuti vanhu vanokuwanai kupi uye vangazive sei kuti mwana anenge abatwa akutora zvinodhaka.
Tinowanikwa tiri muno muHarare. Phone dzangu 0772379751. Unogona kuziva kuti mwana ari kutora zvinodhaka nehunhu hwaanenge achitiratidza. Kazhinji kacho havarari, havadyi zvakanaka, uye maitiro avo nehunhu hwavo anenge atopesana natinotarisira kuvanhu. Vamwe vanenge vanyanya kusvika zvinodhaka kwenguva refu vanenge vakutokanganisika pfungwa zvokuti vanenge vava vanhu vane hasha, vanoda zvekurwa, vanoda kutukana, uye vanotanga kupa zvinhu zvepamba kuti vakwanise kunotenga madrugs aya vanenge vachishandisa. Ndo kuona kwaunoita kuti vana ava havasisiriki kwazvo. Vanoita vatingati pachirungu mamood disorders, vanoita kana depression.
Aiwa, thank you so much, Star. I think we can now go over to my Mahlangu to just lead us off.
Yes, Marvelous. As you know, they say they have this report, Lockdown Through the Eyes of Learners, where they found out most of these problems. Yebo-ke ungasichasisela ke Nkosazana Mahlangu ukuthi izidakamizwa kuyini la kufica ngazo kubulawayo la eMathebelele njalo iziphi konke nje ukuthi uhamba njani namafitshane.
Izidakamizwa sisazitholayo ngocwaningo losathola ukuthi khona kulokuthi bathaba kulomuthi oyi-cough mixture abahlanganisayo engikhohliwe lo ethola ukuthi khona kulonyawope bose kuthiwa enisi bose okunye kuthiwa imbange ngokwazo okunye nje bahlanganisa lapha okunye bathi abakwazi ngoba bobulawa babethi abakwazi kuya kuyini ngoba uNtumbane ngeMpophoma kulaba abahlakile ladies athengisa amabhanzi lawo akedakamizwa leyo badle basebedakwa and kade khuluma ukuthi khona why becabanga ukuthi basebenza khona abanye ukuthi bebalekele ukudlakela ezindlini yabo kudliwa kakhulukazi so benqabe dake kulamashaka lawo bayathethe kaphezulu endaweni zokukhamani kumabholo kuma-water points kuzodakela lokufukwana kule nkulumo kule mhlamba lokuthiwa ongalingananga bona bese bethole ukuthi balokhu emakhaya kakhulukazi balokhuluma ukuthi bahambe bayatsheketsha ekutsheketsheni khona ngale hhayi akulamthetho kwakhona bazitholela nje ama-drugs basebenzise and then abanye bethola khona ukuthi wona beletha esigabeni akhona ayathengiswa khona ngama-drugs abalimazile abanye ama-drugs nalapho.
Yebo-ke, so ngamafitshane singathi ucwaningo lolu kuphenye lakwenzayo ngo-Through the Eyes of ama-Learners lokuthi education is our heritage lakho konke nje lingathi kuyini lakuficayo kwaphathisa kakhulu yini kwezemfundo nxa singathi nje siyenza isifinqo.
Icwaningo lolu lanceda kakhulukazi ngoba sasibalemucelela ekudala abalemhlangano omkhulu ebabiza khona o-PED labo-DSI lapha labanye izihlanganelo ama-stakeholders abakhangele nge-education lakhangele abantwana be-High zabatshela ukuthi ikhangelele lokhu lalokhu i-lockdown idale idakamizwa idale ukuba active emacansini idale ama-child-headed homes, because abanye abazali bahamba bathiya abantwana, all these things. Okuthatha abaqwazi kakhulukazi ukuthi khona ucwaningo lesitshela ukuthi khona umntwana elisinike yena isikolo zibhalwa asiyo umntwana semntwana elizamthola selithola umntwana o-difficult ongasalaleliyo i-concentration, all these things ngoba ubengekho ingqondo.
As much as we'd like to hear a lot, but unfortunately, just a second. If she could give us contact numbers for people that want to follow her report, then we have to be out of it.
Yebo ke i-report le ukuthi abantu bengayithola ngaphi leyo report i-social media zenu kumbe amafoni ukuthi bengayibala ngaphi ngokugcweleyo.
Okay, manje ufuna ukuyibala ngokugcweleyo ikhona ku-website yethu, that's the website yethu down. So I think nxa befuna okulula kakhulu ama-toll free lines bathithwa abawathaphela abanye abayifunayo ama-toll free lines ngaliya u-080 80132134.
Yebo ke. Yebo ke siyabonga. You know, Marv, as much as time is running out, what's most concerning them, Mahlangu is saying that they found that some children access these drugs through grown-ups. Some actually make some buns, cookies, and sell so they get drunk. And some are running away from homes because there's domestic, violence and disturbance. They want to just go and rest there. So it's adults also have a lot to play in ensuring the kids are growing well.
Yes, and also the rural areas have also been impacted, but that's a story for another day. So for today, we'd just like to thank all our guests that were here with us. We had first Miss Chipo Mlambo, who's working with healthcare workers to make sure that maternal healthcare is given to those women, especially those in the rural areas, and also Christine Murombo, who is helping children that have been, affected by drugs and stuff.
Yes, I will also say thank you to Makotonga Mahlangu of Women of Zimbabwe Arise, whose organization has done so much and published so much on education and children. Washington, D.C.
And I'm Marvelous Mhlanga. We are saying have a very good night. Bye-bye.
Bye.